Hello, everyone. Today, the presentation I am presenting is Persuasive Development Disorder. Definition of Persuasive Development Disorder. According to WMD 2005, it states the term persuasive developmental disorders, also called PDD, refers to a group of conditions that involve delays in the development of many basic skills. Most notable among them are the ability to socialize with others, to communicate, and to use imagination. Children with these conditions often are confused in their thinking and generally have problems understanding the world around them. Do you know there are 5 different types of disorders? They include autism, Asperger's syndrome, childhood disintegrative disorder, Rett syndrome, and PDD. Specialists sometimes use the term PDD and autism spectrum disorder interchangeably. Age group preschool 3 to 5 years old and developmental domains. According to WMD 2005, it states PDD disorders are typically identified in children around the age of 3 years old, and this is a crucial period in the child's development. A medical professional must diagnose a child with PDD. There are no medical tests to confirm. Physicians and psychologists test with behavioral evaluations. Doctors will look for developmental milestones during routine visits, but it is important that parents pay attention to concerns about the child's development. Cognitive development. These children demonstrate lack of varied interest, repetitive behaviors, adherence to specific non-functional routines or rituals, stereotyped and repetitive mannerisms, e.g., hand flipping, preoccupation with parts of objects, learn at a different rate than typical children, and by that they learn at a slower rate, and it takes them longer to catch up to the current level of typical children, and they don't make eye contact. Gross and fine motor skills. According to Mental Health 1995, it states part of the issue children with autism have with fine motor activities is that they tend to interfere with their need to engage in stereotype repetitive movements and self-stimulatory behaviors. Children with autism with hyposensitivities to sensory stimulation constantly feel understimulated and engage in a variety of self-stimulation behaviors such as hand flapping or rocking just to have themselves feel more comfortable. Also, children with autism commonly have difficulty walking naturally. Also, according to Mental Health 1995, many children with autism do not develop a normal sense of themselves in relation to their environments. They lack awareness of where their bodies are in relation to their surroundings. Speech daily living. These children demonstrate delay in or lack of communication, inability to use speech to initiate or sustain conversation, stereotyped and repetitive use of language, lack of spontaneous make-believe play or social imitative play, can't verbally use expressive language, once language is developed, does not use language to communicate with others, has echolila, repeats words or phrases repeatedly like an echo. Adaptive skills. These should take take longer in toilet training. Repetitive behaviors, have trouble using zippers like on a coat or zipping up pants. Button snapping, so like a button shirt or button jean, or for example like jeans that need buttoning. Holding skills, so this could be at mealtime, like holding a spoon, holding a pencil, pincer grasp form, pouring milk into a cup, because usually at daycares, the children in preschool have milk cartons, so it's hard for them to pour it sometimes. Play with toys that require fine motor skills, so this could mean magnets, Legos, puzzles, etc., and understanding routines. So you want to tell these children of what is going to happen during the day, so they don't have any surprises. Social emotional development. These children have marked impairment in using multiple nonverbal behaviors such as eye-to-eye gaze, facial expression, gestures, and body postures to regulate social interaction. inability to develop appropriate peer relationships, lack of spontaneous sharing of enjoyment, interests, or achievements with other children, lack of social emotional reciprocity. So that means pretty much a lack of empathy. Solitary play, and what solitary play is tends to play by the child tends to play by himself, and hard to communicate needs and wants. Family participation for children with PDD. Observe, take the time to learn about your child's emotional responses to a variety of situations. Ease your child into new situations that are difficult for him, her. Follow your child's lead and participate in the activities that bring him pleasure. Encourage playtime together. Feelings matter. Put words to your child's feelings and encourage him or her to use the words. Positively praise. Praise your child's appropriate behavior. Capitalize on specialness. Find out what is special and unique about your child and capitalize on it. Watch for signals and respond to your child when they need warmth and attention. Be mindful there are times when they want to be alone. Adjust your levels. Keep your interactions at the child's physical and developmental level. Continued. Don't repeat your instructions over and over because these children will get tired and bored if you keep repeating instructions the same way. And ask for help. Look for a professional to help your child out. A professional could be a speech language pathologist, early childhood education teacher, etc. What are professionals looking for in a PDD diagnosis? Delays in development of socialization and communication skills, using and understanding language, difficulty relating to people, unusual play with toys and other objects, difficulty with changes in their routine and environment, repetitive body movements. Early intervention. Early diagnosis and intervention is key. And research has shown that if when once children receive early intervention services at a young age, they tend to likely progress better and have more of an impact on their development as well. Enrolling the child in an early intervention program can help with their success. Programs must be tailored for each child as symptoms are different for each. And so basically what that's saying is that since on the since for disabilities such a huge spectrum, uh, there's since there's a huge spectrum of disabilities from a severe to moderate or really mild, pretty much programs have to look for each specific one. Speech pathology, fine and gross motor skills therapy can be used. So for a speech pathologist, they could help these children learn how to speak verbally like expressive language, and also receptive language of understanding what the child's needs and wants are. And then individual education program IEP should be used for the child. So definitely having IEP if your child has PDD is a great thing because then the teachers know what to expect and they can work on strategies and intervention for your child. Conclusion. Children that have PDD who are enrolled in early intervention services will more than likely develop better social skills and progress. Research has shown that children with disabilities that are enrolled in early intervention services tend to succeed and gain progress on their disability compared to other children that wait longer. So, so the bottom line is that get if you have your if you get your child into early intervention services at an early age, the more likely they'll gain progress in their development, and also it'll benefit the teachers and especially the child as well. Mainstreaming children that have PDD in a general education classroom will benefit them in many ways, including enhanced communication skills, forming relationships with other children, social interaction, buddy system, and learning routines. So basically, inclusion for these children with PDD further will further enhance their communication skills, and also it will benefit all the rest of the children and the teachers as well. And here are my references for my presentation. Thank you so much.